Hi guys, my name is Penicillins and my generic names are Penicillin G benzathine, Penicillin G potassium, Penicillin G procaine, and Penicillin V. And for my brand names are Bicillin or Permapen, Pfizer Pen, Vicicillin, and Vitiz. And for my chemical name is For my drug classification, for therapeutic is that I am considered as antibiotic, and for pharmacologic is that I am penicillin, and for my pregnancy category is that I am pregnancy risk category B. For my mechanism of action is that I inhibits biosynthesis of cell wall mucopeptide, kills penicillin susceptible bacteria during active multiplication stage. So my pharmacokinetics for penicillin G is that for absorption is that sodium and potassium salts of penicillin G absorbed rapidly after IM injection, peak serum levels within 15 to 30 minutes, slower reabsorption of other salts. Serum levels of penicillin G procaine peak in 1 to 4 hours with drug detectable in serum for 1 to 2 days. Serum levels of penicillin G benzathine peak in 13 to 24 hours with serum levels detectable for 1 to 4 weeks. And for distribution is that penicillin G distributed widely into synovial, pleural, pericardial ascitic fluids, bile, liver, skin, lungs, kidney, muscle, intestines, tonsils, maxillary sinuses, saliva, and erythrocytes. Poor CSF penetration but enhanced in patients with inflamed meninges. Penicillin G crosses the placental barrier is 45% to 68% protein bound. And for metabolism is that between 16% and 30% of IM dose metabolized to inactive compounds. And for excretion is that it is excreted primarily in urine by tubular secretion. 20% to 60% of dose recovered in 6 hours. Some drug appears in breast milk. Elimination half-life in adults is about 1/2 to 1 hour. Severe renal impairment prolongs half-life. Penicillin G is removed by hemodialysis and is only minimally removed by peritoneal dialysis. And for my pharmacokinetics in penicillin V is that for absorption is that penicillin V has greater acid stability and is absorbed more completely than penicillin G after oral administration. About 60% to 75% of oral dose of penicillin V absorbed. Serum levels peaks at 60 minutes in fasting subjects. Food has no significant effect. For distribution is that it is distributed widely into synovial, pleural, pericardial, and ascitic fluids, and into bile, liver, skin, lungs, kidneys, muscle, intestines, tonsils, maxillary sinuses, saliva, and erythrocyte. CSF penetration is poor but enhanced in patients with inflamed meninges. Penicillin V crosses the placental barrier and is 75% to 89% protein bound. And for metabolism is that between 35% and 75% is metabolized to inactive compounds. For excretion is that it is excreted primarily in urine by tubular secretion. 26% to 65% of dose recovered in 6 hours. Some drug appears in breast milk. Elimination half-life in adults is 1/2 hour. Severe renal impairment prolongs half-life. For indications is that I am indicated in congenital syphilis for penicillin G benzathine and group A streptococcal upper respiratory infections, diphtheria, yaws, pinta, and bigel for penicillin G benzathine, prophylaxis of post-streptococcal rheumatic fever for penicillin G benzathine, syphilis of less than 1 year's duration for penicillin G benzathine, syphilis of more than 1 year's duration for penicillin G benzathine, moderate to severe systemic infections for penicillin G potassium sodium, and moderate to severe systemic infections, pneumococcal pneumonia for penicillin G procaine, uncomplicated gonorrhea, penicillin G procaine, anthrax for penicillin G potassium, anthrax caused by Bacillus atracis including inhalation anthrax for penicillin G procaine, and cutaneous anthrax for penicillin G procaine. My indications for penicillin V is that mild to moderate susceptible infection, necrotizing ulcerative gingivitis, Lyme disease, prophylaxis for pneumococcal infection. For my contraindications is that I am contraindicated to hypersensitivity to penicillins, but beta-lactamase inhibitors or benzathine, and contraindicated in patients hypersensitivity to drug or other penicillins. Used cautiously in patients with drug allergies, especially to cephalosporins or imipenem. For my side and adverse effects for CNS is neuropathy, seizures, lethargy, hallucination, anxiety, confusion, agitation, depression, dizziness, and fatigue. For the GI is that I cause nausea, vomiting, epigastric distress, diarrhea, blocked hairy tongue. And for CV is that thrombophlebitis. And for GU is that intestinal nephritis, nephropathy, and for hematologic is that I cause hemolytic anemia, eosinophilia, thrombocytopenia, leukopenia, anemia, agranulocytosis. And for metabolic is that I cause severe potassium poisoning with high doses. And for skin is that I cause pain and sterile abscess at injection site. And for others is that I cause hypersensitivity reactions, overgrowth of non-susceptible organisms. So for nursing responsibilities, before administration, a nurse must assess for contraindications and cautions, history of allergy, pregnancy, to avoid adverse effects. Perform a complete physical assessment to establish a baseline before beginning therapy, monitor effectiveness of therapy, and evaluate for any potential adverse effect during therapy. And during administration of the drug, the nurse must monitor nutritional status to provide nutritional consultation as needed and provide comfort measures to help patient cope with drug effects. For after administration, the nurse must monitor patient response to therapy and monitor for adverse effects. Thank you for watching and listening.